As you can see, she's incredibly beautiful. We're going to ask Andre to zoom in with the camera, please, because I'm sure everybody wants to see Lindsay's beautiful face and not my ugly old face. Okay, so if we come nice and tight into here, what we're going to look at is some of the key caveats of how we assess our patient's lips. So what we're going to do is just ask you just to turn it just ever so slightly this way, Lindsay, and just look straight down the camera for me. Okay, so what have we got here? So we've got beautifully full lips which are in direct proportion with the face. The first thing that we always need to do is our static and dynamic assessments. So what we're looking at here is a lip beautification. Now, one of the most difficult things about these cases is that it's very easy to make the patient look worse. So the more beautiful the patient is, I feel the more difficult it is to get a great outcome. She's 43, so we need to keep the lips age appropriate. So again, we need to use a filler in the right plane with the right rheology to keep everything looking extremely natural. So what we're going to do is just look at the frontal aspect. And when we look at the most beautiful part of the face, we look at the facial fifth or the central fifth. And that is the head of the eyebrow, the inner canthus of the eye, the width of the alar, and the width of the female chin. Now, if our patient purses her lips really tight as you can see all of the maximum volume of the lip is inside the alar. And just relax. So this is what we call the central fifth. It's the most beautiful fifth of the face. So one of the first things that I'm going to do is I'm going to keep all of the product inside of this central fifth. Now, if your patient has ethnic variations and they have a wide alar base, you can always use the inner canthus of the eye as your guide, because this intercanthal distance does not change throughout our lifetime. So we're going to ask Lindsay to give us a big smile. She's going to pretend she's happy, and a big kiss. So again, we can see that we need the filler to move with the muscle and not fight against it. So our choice of rheology is incredibly important. We're also going to look at lateral profile, and Julietta did a great job telling us about reference line. And what we have here is we have Lindsay, who's a classical Caucasian, very beautiful. I'm going to ask to sort of really come all the way around, and you can see the birthstone line here, where the upper lip should be slightly anterior to the lower lip from the subnasally to the begonian here, and she fits that conformity absolutely beautifully. So what we're going to need to do is treat the upper and lower lip pretty much exactly the same. So how do we do this, and what are our anatomical considerations? Well, I've already spoken to you about the middle fifth. So that's the first thing that we're going to draw out. We're going to draw our starting points for this lip technique. So what I'm going to do is draw two vertical lines. And the first vertical line is at the alar here. So we're just going to make these little lines down. And we're going to ask Lindsay to turn this way, and we're just going to do the same on this side. And this will keep us symmetrical, but will also keep us conforming with what Mother Nature gave us. So there's our little lines. Again, purse your lips really tight for me. Again, all of the volume should be inside of those two lines. When we look at the vascular anatomy here, I'm not going to take you on a tedious journey through the from the masseter all the way up. I'm actually going to start at the commissure, and we have something called the rule of thumb. And the rule of thumb means that the facial artery will be outside of your thumb in this position. Then it will give off a couple of branches. It will give off a lower branch, which is the inferior labial artery, into the lateral third of the lip. As it climbs towards the nasolabial fold, it also gives a branch here. Now, Raul has got some beautiful illustrations of the artery and the depth of the artery in these positions. What I would like to add to this is that the artery here in the lateral third of the lip is at its widest diameter and superficial. So again, for those techniques which run deep into the lip like this, it's super high risk. And you may have seen hematomas on your patients in this area quite often. You've been very fortunate to go through the superior labial artery and come back out and not fill this area up. So I'm not going to do any injections behind this line. I'm actually going to let the filler do the work. And what I mean by the filler do the work, I'm going to use a very simple technique, and I'm going to allow the product to work its way anterograde, like Raoul had shown you, up to the Cupid's bow. Now, from my injection point, it's also going to come back here because we feel that this is a little anatomical tube, and what it will do, it will kick up the corner of the mouth like this. But also on projection, we're going to come all of the way around. It's going to project and avert Lindsay's upper and lower lip. And we're going to do this by utilizing a little anatomical tunnel, which is just present underneath. And what we'll do, we'll take a little look at this in a little bit more finer detail when we lay Lindsay back in the position that we're going to do the injections. And you can go back in that position now. Lindsay, can we go overhead, please, Ken, on this? Firstly, I'm going to show you the instruments of choice. You have a couple of instruments which you can use. You can use, and come in as close as you can, please, Ken. You can use the standard needle which comes with your product, or you can modify your technique. So traditionally, we would use one of these needles here. I'll try and do it on my glove. Hopefully you can see this traditional needle here. What we're going to use is a little tiny 4mm needle here. And this is a little 32 gauge because I've got a very fine filler. And what this is going to do is reduce the pain, reduce the risk of hitting one of the arteries, and reducing the extrusion force, which can be pretty painful for our patients. I'm going to allow the product to do the work here. And the technique is what I call a liquid lip line. And it's a gateway for patients. You know, you have those patients and they say, I don't want to have my lips treated, but I want them treated. I'm scared to look over-treated. I always say to them, I'm going to use a very fine filler and we're going to do a liquid lip line. And it gives them the confidence and the ability to then maybe request volumization further down the line. So what I'm going to do here is I need to find this little tube, and I'm going to go from this reference point. And what I'm going to do is use this finger with, it's my most intelligent finger. And what it's going to do is locate the superior labial artery, and it's going to close it off here. I'm using targeted digital pressure. So I'm pushing down on Lindsay's teeth here. So what I'm going to do, I've got a product which is 15 milligrams of just 1.9% cross-linked, the highest stretch of all fillers that we have available. And I'm going to allow the product to move through this little space. It's a little space which myself and Raoul have been looking at for many years now. You can see that this little 4mm needle is inside here. Now, hopefully what we should see is the product travel anterior to, I'll keep my finger out of the way so you can see this. It travels anterior to the tip of the needle. Now it looks like I'm making a bolus here. In fact, it's filling up this tube like an inner tube of a bicycle wheel. And it gives you this wonderful aversion and projection. And it's a very, very easy technique. It takes a little bit of practice, but once you have this technique, you can even augment lips without volumizing. And I'll show you how I would volumize a little bit later. So we're going to put 0.1 in every one of these little tubes. And what we've got here, I don't know whether you can see this well enough from Seema, but we've got a whole tube now which is filled with a product. Okay, you may see from this angle, it's gone all of the way back from this point into the lateral aspect, and you can see there is a nice architecture. I'm going to do the same on the lower lip, and then we're going to go over to the opposite side, keeping to the same points.
Lee, can I just stop for 2 seconds? Can you just go back to that finger? Because I saw quite a lot of the audience stop for a moment and go, explain that one more time. You put pressure in a certain point, so can you just give us a little bit more of an explanation? Thank you.
Yes, thanks, Liana. So I'll make it a little bit more visual here. I've got to turn Lindsay ever so slightly this way. So we know the artery comes into this position here, and it's wide. So what I'm doing here with my intelligent hand is closing the artery off like this. So when I inject, I'm going to make that artery as small as possible. I'm going to make it as difficult as I can for the filler to get inside the artery. It's what we call targeted digital pressure. So you can do this on the nose, you can do it on the ascending mental arteries, the mental, the facial artery, all of the arteries here. I always close the arteries off before I inject.
Brilliant,
So
thank you so much, thanks.
You're very welcome. Same here with the inferior labial artery. I'm trying to make it as small as I can before I inject. And I'm going to be very flat to the skin. And I'm going to allow the gel, again just 0.1 here, to travel through this little tube that we've been exploring for quite a while now. Now, a lot of you will already utilize this little tube to your advantage, and I feel it's one of the best techniques that you can use to augment and beautify lips. And this product has traveled from this position, and hopefully you can see it. It's traveled back behind the line, but it's also traveled across the midline here. And this is the great thing about it. This technique is just 4 injections, and Steve Harris spoke yesterday about techniques which take up to 70. Again, if you are injecting 70 times on your patient, you've got 70 times the risk. I'm going to move to the opposite side. Keep to the same principles. I'm going to go from the lateral alar of the nose. I'm going to be very flat with my 32 gauge 4mm needle, and we're going to put 0.1 in exactly the same positions. Now you have to be brave, because sometimes it looks like the filler is beginning to make a little bolus. In fact, it doesn't do this. It just opens up that little tissue space and starts to travel. So it does take a little bit of bravery to get you going. Now you can do the Cupid's bow if you wish. I don't think that you need to. I think that it just will travel across in this position. And you can already see the effects of the lip, the volumization, the augmentation here, and all I've used is just 0.3 at this point. I'm going to go back to the lower lip, use exactly the same principle, allow the gel to meander and move through the space, this little anatomical space, which is a very, very low risk plane of injection. And as you can see, I've injected Lindsay's lips 4 times, and there is a complete absence of bleeding from any parts of the lip. And this is great for your patients because there's no bruising, there's no downtime, there's nothing really. Your patients can go back to the office, back to work, back home, without really being worried or concerned about anything in terms of, and I can feel all of the product, it all feels linear. Now, sometimes you have a little break in the center, and if that's the case, you just let the product just run across the midline. And I'll just show you, you may be able to see it quite nicely. I do apologize, Lindsay, midline injections tend to be a little bit painful. You can just see it run across very nicely here. So I've used just 0.4, and I've got a lip which is averted, I've got a lip which is projected, defined, and what I'll do, I'll show you how I massage. I think massage is very important, it's very underutilized, and we'll get our beautiful patient to animate in a second. So I use a little bit of protection, a little bit of barrier cream between the gauze and the lip, and what I tend to do is get a little bit of dry gauze, and I open it up. I ask Lindsay to open her mouth, and I roll up the lip, and I feel whether the product is feeling very homogeneous and smooth in this area. If you just use your gloves, all you feel is the wet gloves and a very smooth lip. When you use dry gauze with a little bit of cream, you can feel all of the little irregularities, and it allows you the opportunity to just smooth those out. So remember, this is a technique, a gateway technique. It's a very low risk, high reward technique, utilizing the vermilion border and the vermilion channel as a guide. We're going to ask our beautiful patient to sit up. Okay. We're going to look at the front. Can we come closer? We're all friends here. So this is just 15 milligrams, as Raoul said. We don't want too much HA here. We're going to ask Lindsay for a big smile. And say it in French, bisous s'il vous plaît. Big kiss, okay? And you can see the product is absolutely just moving beautifully with the lip and not fighting against it. We're going to turn Lindsay all the way here and look at the inversion and projection. We've kept that absolutely beautiful with just 0.4 a filler, and that is the 4mm lip line technique by the one and only Lindsay. Thank you.
Let me ask you one question. So